So we restored posterior glide of the right femur. So now I can push and take up the slack and I can bounce it. And the patella is no longer compressed posteriorly, so we have good left and right mobility. And we have good inferior mobility as well. And now I'm going to lift his foot up, and it just doesn't go as high as before. It no longer hyperextends. Sit up and we'll test your strength. Okay, straighten out your right knee and don't let me bend it. On the count of 3. 1, 2, 3, go. Give me everything you got. And I can't break it. So lastly, let's have you walk down the hall and come back and just tell us how you feel. Your thoughts?
Definitely a little less rigid, like you were saying in the beginning. A little more stable overall.
Uh-huh.
Not 100%, but better than I felt when I came.
Nice.
Yeah.
Nice. Excellent. Good. I'll keep looking. You have a little tightness in your hip rotator, so we're going to treat that next.
Okay.
And then I'm going to treat your left AC joint that's compressed.
Okay.
But this summarizes the evaluation treatment for a posterior glide fixation of the right femur. Thank you very much.